Hello and welcome to another lesson. For this one, we are looking at the structure of the listening subtest. In the previous lesson, I mentioned that there are three parts in the listening subtest, parts A, B, and C. So we are looking at these in detail. Part A has two patient-centered consultations. It means you would hear the health professional and a patient, and this could either be a referral to a specialist or an emergency ward admission. And these recordings are excerpts from lengthy consultations. You don't have the full thing, just a part of it to help you answer the questions that you have. Each of the extracts plays for 4 minutes 30 seconds. In all, you have 15 minutes for the part A, and you are answering 24 structured note completion questions. You'd have to get the answers, and you usually do not have sentences but phrases or notes to answer. And to be able to answer these questions, you need to be able to understand, interpret, and record specific information based on the questions that you have on the question paper. Then again, the questions have been structured. So you have subheadings to help you know exactly what is being talked about at a particular time to be able to answer the question. So for example, you see the subheading medical history or further treatment or referral plan or management. You're using these as cues, as guides to enable you to tell where the information that you are where to get the information, at what point is the recording now, so that you can answer the questions that you have. And you're doing this in 15 minutes, like I said, answering the 24 questions. In the previous lesson, I mentioned that you need the answers. All the answers that you need are contained in the recordings that you are listening to. For part A, because it's patient-centered, almost all of the answers to answer the questions, almost all the answers to the questions are contained in the information provided by the patients. Of course, there are exceptions to this rule, because during some occasions or during some parts of the recordings, the answers are contained in the information presented by the health professional. Whatever it is, whether the answers are coming from the patient or from the health professional, you need to be able to listen to both of them, because it is the questions of the health professional that would trigger the patient to respond. And so if you are not aware of what the question from the health professional is, then you may not be able to get the information to answer the questions. You need to listen to both parties to be able to answer the questions. All you need to do is to listen attentively to what is going on, understand the context, interpret the information right, and your ability to record the specific information, the details of the information, would help you to answer the questions that you have. It's a listening test, and so you should be able to train yourself to listen. When you get to subsequent lessons, we'll be looking at tips, and we'll discuss a lot of what you need to equip yourself with to be able to answer the questions. In part B, you are listening to 6 monologues or dialogues, and these are 40 to 60 seconds everyday communication. They happen almost on a daily basis in healthcare, in the healthcare sector, as far as their workplaces are concerned. And if it's a dialogue, then it's going to be either between a health professional and a colleague, or a patient, or a caregiver, or the relative of a patient, or a stakeholder. And such communication in the workplaces that you hear in Part B include handovers and giving and checking instructions. To be able to answer questions in Part B, you need to focus on just the overall information, the overview in the information, the central information that is being put across. For example, what is the conversation about? You need to be able to tell that after you have listened to that part. And you need to be able to listen to opinions as well, the views of either the professional or the colleague or the stakeholder that is in there. Sometimes it could be monologue, so you just hear one person, and you need to be able to get the opinions they share on whatever subjects they are talking about. You need to listen to detail as well, get specific information, then speaker or listener cause of action, because at some point it would be the giving or checking of instructions. You need to know what the speaker or the listener is supposed to do thereafter. There are 6 questions, so each monologue or dialogue has a question, and there are 3 option multiple choices that you have to choose from. When you get to Part B, you need to be a little careful, especially with regard to how well you are doing the listening. Because for the 3 options that you have, there would usually be the odd one out. That particular option would have nothing said about it at all, so it will be easier for you to pick that out. But then with the 2 remaining options, one is the actual answer and the other is the distractor. And so at some point, it will be difficult for you to tell which one is the distractor and which one is the actual answer. Because the distractor may just be a partial information of the actual answer. And if you're unable to read and understand very carefully, then you're going to settle on the distractor. The distractor may also be that it contains an extra information which is not provided for in the excerpt that you listened to. It'll be very difficult for you to tell if you don't pay attention. Sometimes it would be a contradiction of what was said in the recording. To be able to definitely settle on the actual answer when it comes to the distractor and the answer to the question, listening attentively, listening with every faculty of yours is very, very necessary. You need to follow and understand what is being said to be able to tell which one is the answer and which one is the distractor. The same applies to the options you have in Part C. You need to be able to listen very attentively, and you use the same technique that I've given when it comes to the multiple choice options. A contradiction, the odd one out, an extra or a partial information. This should guide you to settle on the right answer after you've listened attentively. Let's look at what happens in Part C. There are 2 long presentations or interviews, and each of these go on for between 4 minutes 30 seconds and 5 minutes. You're doing the part C in 15 minutes as well. So this would definitely include recorded instructions, time to read the questions and check the answers when you're done. There'll be 12 questions, 6 for each of the presentations or interviews that you have. And these presentations or interviews are clearly structured and cued to guide candidates through the questions. So they would, if it's an interview, you would hear the interviewer asking the interviewees questions. So the questions come and then the response. So it is from that response that you get the answer to the questions. Of course, the questions of the questions of the interviewer, for example, wouldn't correspond with the questions you have on the question paper. So in addition to listening to the interviewer's questions, you need to read the question on the question paper. Your priority is to get the question on the question paper, because that is what you're supposed to answer and not the questions of the interviewer. The presentations and interviews in Part C express views and opinions rather than facts. It's usually health professionals who tell you about their work in different aspects of the health of humans and animals, because veterinary scientists also take this test. And the listening subtest is generic. It is not profession specific. So whether you are a nurse or a doctor or a professional therapist, you're doing the same listening test. You are listening to the same recordings and answering the 42 questions that you have to listen. I'll see you in the next lessons as we discuss the tips and strategies that you would need for the listening subtest. Good luck and see you soon.